We've been getting a lot of comments on our AKN removal videos. People are curious, can creams or topicals help AKN?
All right, well, so it depends on your definition of help. In other words, what your goal is in terms of treatment. We can see all the different forms. One treatment might work for one form and not the other. So what do we mean by early? Early will be when you have very fine lesions that are beginning to form. They're just slightly inflamed. You don't have any masses, loss of hair and things like that. Those are usually earlier forms of AKN. The underlying condition that leads to AKN is called PLIF. It's an inflammatory condition that affects the entire scalp. So better still, you want to catch that condition where you just have some little niduses of inflammation, irritation, and you use your topical. That really helps. But even with that, it tends to be very temporary, provided the patient understands that, knows what to expect, and they will keep coming back every month or two to get the same treatment. If that really works for you and you're happy with that, then that's okay. But if you want something longer term, then you probably will be looking for definitive procedures, the kind of things we do with our patients where we treat them and we usually don't get to see them forever after a while. So that would be the ideal goal, right? So understand the disease, understand that there are very early forms, pre-AKN conditions that topicals could be helpful with, but even with that, understand the limitations of them. For more information, follow our account. If you think you have AKN, you should see a dermatologist. Thank you.